There have been a lot of misleading statements and in some cases just plain out inaccurate statements made through the course of the healthcare debate. You might have seen some at some of the town halls that Democratic members of Congress have been having around the country. We attended one in Reston, Virginia earlier this week. It was hosted by Representative Jim Moran and former Vermont Governor Howard Dean. We heard some of these same claims at the town hall we attended, and now we're going to assess their accuracy and decide what's fact and what's fiction and what might be something in between.
The cost of the bill would be roughly $100 billion per year for the next 10 years. But that cost is going to be fully paid for.
It's a misleading statement at best, and we could probably fairly say that it's false. What Democratic leaders have been saying is that the health insurance reforms in their bill are fully paid for. That's a very carefully worded statement because part of the overall bill is not paid for. The bill would add $239 billion to the deficit over its first 10 years, according to the Congressional Budget Office. Further, in the next 10 years and subsequent decades afterward, the Congressional Budget Office says they believe it would add a lot more red ink to the deficit because, and this is because a lot of the financing measures, for example, a tax increase, kick in before the actual reforms kick in. So, for example, they're going to start assessing a surtax on wealthy taxpayers beginning in 2011, but they won't actually offer new insurance plans until 2013. The next thing we're going to look at is this claim that the bill would create so-called death panels. Moran addressed this up front at his town hall.
Many people feel, apparently, that death panels made up of so-called government bureaucrats will determine whether a patient is worthy of health care. People call it I've seen on the internet, the kill grandma clause, things like this. This is nonsense.
Moran's absolutely right about this one, and here's why. The House bill has a section that would authorize Medicare to pay doctors to consult with their patients about things like living wills, advanced directives, a new document that's called a physician's order for life-sustaining treatment. The payments wouldn't be determined by whether the patient actually writes a living will or an advanced directive. The doctor gets the payment regardless of what the patient does. It just requires that the doctor goes through a couple of specific areas, including what is an advanced directive, what is a physician's order for life-sustaining treatment, here are the advantages, here are the disadvantages. It's a completely voluntary program. People aren't required to have these conversations with their doctors. The doctor could initiate it if he wanted to, and the patient could say, look, doctor, I don't really want to talk about this, and that's the end of it. But Democrats hope that if they include this clause in the bill, they'll encourage more use of these types of documents so that people will start taking more charge of what happens to them at the end of their lives.
There's $200 million over 10 years in savings if we had tort reform, and nobody loses but the lawyers. Why have we not even considered that tonight in the discussion, sir? Tell the American people that.
The gentleman's right. Medical malpractice liability reform isn't addressed in any of the Democratic bills. And Howard Dean gave a relatively candid explanation why not.
Here's why tort reform is not in the bill. When you go to pass a really enormous bill like that, the more stuff you put in it, the more enemies you make, right? And the reason that tort reform is not in the bill is because the people who wrote it did not want to take on the trial lawyers in addition to everybody else they were taking around. And that is the plain and simple truth.
But under this proposal, no one will lose their current health coverage. So that means
the bill doesn't guarantee that you could keep the coverage you have. There seem to be occasions sometime after the full insurance reforms are implemented, about 2013, in which you might lose the insurance you have. So these claims we can't say are entirely accurate. We can't say they're false either because it'll probably depend on the final version of the bill and probably also on how the government actually implements the bill, the regulations that the government issues to actually put the law into effect.
I thank all of you for coming. Thank you for participating, and it was helpful.
As Congress returns in September, there are undoubtedly going to be more claims made about this bill, and Congressional Quarterly and cqpolitics.com will continue to assess them.